You know, I think I've got the blues. I just don't feel like myself these days. And I've just lost interest and pleasure in doing the things I used to do, like walking, visiting with my children. I just don't even feel like getting out of bed some days. And I even went to my doctor and they ran tests. They didn't find anything, but something's wrong. Hello, I'm Dr. Suzanna Waters Castillo, Director of the Mental Health and Older Adult Certificate Series. And if you're a professional and you hear statements like this from an older adult, it may warrant geriatric depression screening. I'm going to share 3 points that are very important about geriatric depression. First of all, depression in late life is not a normal part of the aging process. However, there are myths and misconceptions about growing old and mental health or mental illness. And these misconceptions are held by providers as well as older adults. And this has resulted in untreatment and mistreatment and much distress for the older person. Secondly, geriatric depression is a medical illness. It is not due to a moral flaw or any type of social mistakes that an individual may have made in their life. And it's very important for providers to understand the relationship between chronic conditions in aging and depression, because these chronic conditions can mask the depression itself. Third, geriatric depression is very treatable. The Centers for Disease Control indicate that up to 80% of the individuals treated effectively will result in positive outcomes. And these effective treatments include evidence-based screening with the PHQ-9 or the Geriatric Depression Scale, and using evidence-based treatment modalities such as cognitive behavioral therapies and/or antidepressants. So if you're interested as a professional in learning more about effective screening and treatment of older adults with mental illness, please see our website for the Mental Health and Older Adult Certificate Series. Thank you.